Hey everyone, I'm Ellie, and when I was 14 years old, I was diagnosed with a rare childhood cancer called alveolar rhabdomyosarcoma. The diagnosis was such a shock. Like, I'm 14, I'm not 50, I'm not supposed to get cancer at 14 years old, but it happens, and I knew that children could get diagnosed with cancer, but you would have never thought it was you. And it was really daunting, the cancer diagnosis, because I'd never had really any medical issues before. So it was like being thrown in the deep end with chemotherapy, radiotherapy, and it was hard. It was really hard. And I should have been at school hanging out with friends, but I was in a hospital and it just wasn't fun. And just having cancer as a child is quite hard, just because you do miss out on a lot. I missed out on my football team's big game in a stadium, and I missed out on just loads of things at school that I could have taken part in, and it was tough. And it comes with its challenges, just really hard challenges which you know you can't make you could make a decision on, but it's a life or death decision, like doing chemotherapy, which comes with loads of side effects, and same as radiotherapy, and that is the biggest challenge. Some of the biggest challenges that I faced during my treatment was the long-term side effects from the radiotherapy. The first one was infertility, which is quite hard, even though it's not really affected me too much now, but I know when I'm older and my friends start getting pregnant and having babies, I will find it hard because I'm not normal. I can't live that normal perfect life. You get a husband and then you get pregnant. And then have a baby. Mine's like completely changed. I think I can get a surrogate, or I can adopt. I know I definitely want to adopt, but I think I would definitely want to try out a surrogate as well. But yeah, it's hard, and you shouldn't be told at 14 years old you're infertile. Yeah, it's not nice at all. One of the hardest challenges, which made me cry when they told me, because it was just such a shock to me, that the radiotherapy could give me cancer when I'm older. So the thing that is saving my life could possibly end my life when I'm 40 years old. It was hard to get my head around that. You would, if you had a choice, you would prefer, oh, I won't do radiotherapy just to lessen the risk of getting cancer when I'm older. But you're going to have to, because I had to get rid of this cancer, and it's not fair. It's just not fun. Like, I don't want to live my adult life thinking, oh, could this be cancer, could this be cancer, or keep checking out for cancer just because obviously the side effects of radiotherapy, and it's just not fun. The constant fear that my cancer will come back. I have 3 months until I am officially in remission, and I should be super excited, which I kind of am, but I'm also really scared just because there's always that fear of relapse. It's like you can't get away from it, because there's so many children on social media that I see with the same cancer as me who are relapsing. There's one girl who had my type of cancer 8 times, and she just died only recently. And it is scary because you keep thinking to yourself, oh, that's not going to be me, or let's just try not to think about it. But in a way you kind of feel guilty, because you're like, why should they relapse and why wouldn't I relapse? And it is hard because I don't want to go through this again. This is hell, and I just don't want something to stop my life again. My life is going well at the moment, and I just want to continue on with school and hope to go to university, and have a family and stuff, and I don't want this to ruin that again. The absolute hardest challenge of having childhood cancer is the lack of funding. Due to the lack of funding of my cancer, my prospect of survival is 50%, because my cancer is stage 4. And it is scary because my life is decided on with a flip of a coin, and it shouldn't be like that. No child should have that. Like, it's just scary. So many kids, like, there's some children that I know who have DIPG, and because there's such a lack of funding and such a lack of research into their cancer, their chance of survival is 0%. Like, there's so much funding for adults, whereas childhood cancer gets 4%. And that isn't right. Like, single cancers such as like breast cancer get so much more than we do, and I find it unfair. It's not right. Maybe it's not. Children, cancer is rarer in children, but it doesn't mean that we shouldn't get more as well. Cancer is actually the biggest killer of children. So something needs to change. Due to lack of funding, we are receiving toxic adult treatments, which are absolutely horrendous on our bodies because we are still children, we are still growing, and when something messes up with us growing, it's gonna not turn out well. Like, I know a young boy from the ward who has the same cancer as me, and he has actually got heart problems from the chemotherapy. No 4-year-old should have to worry about heart problems. No, that 4-year-old's mum shouldn't have to worry about her 4-year-old having heart problems. It's not fair. I also know a girl from America who had to have part of her leg, like bone, replaced with these metal nails and screws, and because of that she's not allowed to jump or run. And what quality of a childhood is it not to be able to run and play with your friends? This is why more funding needs to happen, because we need to get more funding so children don't have to go through this. They shouldn't have to live with that burden for the rest of their lives, with these harsh side effects and amputations that have to happen. Even though it's getting rid of the cancer, what quality of childhood is that? Getting your leg amputated or having to live, like I've got quite bad IBS and colitis, I think it's called, from the radiotherapy, and I'm going to have to live with that for the rest of my life. One girl that I know actually died, not from the cancer, but from the chemotherapy. And that just shows how toxic these drugs are on children. Things need to change now. We can't keep living a lie. Childhood cancer does happen. We need action now to get more funding for children and get more research so children have better prospects of survival. Thank you for watching this video. I hope it gave you a bit more of an insight of the challenges that children with cancer have to face. And please do share so we can spread more awareness of childhood cancer, because my ultimate goal is to get childhood cancer heard, because we do deserve more. We do deserve more funding, and people just, it's like we're forgotten about. So please do share, and please like, and also subscribe for more videos.